So I want you to picture this scene. It's early morning, and an older Great Dane is lying on his bed, and he hears that unmistakable jingle of a leash coming off the hook.
Oh, they know that sound instantly.
Right, exactly. So instantly the head comes up, his eyes are super bright, his tail is just thumping rhythmically against the bed frame. That internal fire, like that fundamental desire to go outside and be with his people, it just hasn't dimmed one bit.
But then, you watch the actual physical response.
Yeah.
The spirit is completely willing, but the body just takes a long, calculated moment to catch up.
Yeah, getting up just takes noticeably longer. He pushes up with his front legs first, kind of pauses to find his balance, and then the hindquarters slowly follow.
Right.
And one back paw kind of searches the floor, looking for a solid grip before he finally commits to standing. Then he walks to the door, stops right before that single step down into the yard, and just waits. He waits patiently for his family to set out the ramp they now have to use every single day.
It's a very common, very poignant image for anyone who has cared for a giant breed. I mean, it captures the reality of this stage of life perfectly. It's that intersection of a perfectly willing mind and a changing body.
And that intersection is exactly what we are focusing on today. This deep dive is completely dedicated to you, the listener, who really wants to understand the nuanced day-to-day reality of senior dog care, specifically for giant breeds like a Great Dane.
Yeah, because it's a unique challenge.
It really is. And our mission today isn't to just run through some depressing list of things an older dog can't do anymore. We're here to figure out how to fiercely protect what they can still do while genuinely respecting, the structural limitations of their aging body.
And to do that effectively, we have to throw out our standard human ideas about aging altogether.
How so?
Well, with giant breeds, because they generally have a shorter lifespan compared to smaller dogs, there is no universal senior birthday where a switch just flips.
Right, it's not like turning 65.
Exactly. You could look at two 7-year-old Great Danes, and they might be in completely different universes physically. Like one might be hiking miles a day, while the other is facing severe decline in muscle or heart health.
So if chronologic age is essentially a useless metric for these dogs, what are we actually supposed to be measuring?
We have to measure deviation from their personal baseline. So the crucial question isn't how old is he, it's what has actually changed from his adult normal.
Which is where your daily observations as an owner become a total superpower.
Oh, absolutely.
Keeping casual records throughout your dog's life, their weight history, notes on their body condition, short videos of how they move, photos of lumps, that stuff is incredibly valuable. You don't need a crazy color-coded spreadsheet, but having that baseline is the only way you can accurately spot those deviations before they become full-blown crises.
Because the goal isn't to anxiously test for every possible disease under the sun, The goal is to catch meaningful functional changes early. And understanding that age is measured by those physical changes leads us into probably the most misunderstood metric in senior dogs.
Let me guess, their mass. The dreaded scale at the vet's office.
Yes, the scale is a notorious liar when it comes to senior Great Danes.
A liar.
Totally. A dog's weight might stay perfectly stable on paper for 2 years, giving an owner this completely false sense of security, while crucial muscle is quietly wasting away and being replaced by fat.
Wow. I suppose on a giant breed, replacing even like 5% of their muscle mass with fat is a massive amount of physical tissue changing composition, right? Even if the net weight remains the exact same.
It's huge. I mean, fat is less dense than muscle, so a dog can actually look bulkier while getting physically weaker.
That's wild.
And if the weight drops, it could mean muscle loss or dental pain preventing them from eating, or heart disease or kidney issues. But if the weight climbs, it could be fluid retention from a failing heart, reduced activity, or, honestly, just extra treats from a family trying to spoil their senior dog.
Right. We all want to give them an extra cookie. So looking at a single number is practically useless. Where on the dog's body should we actually be looking to assess this?
You want to evaluate their body condition visually and physically. Watch the shoulders, run your hands over their back, and pay special attention to the thighs and the hindquarters.
So the back end, mostly.
Yeah, ask yourself, how easily does he turn around in a narrow hallway? How does he handle standing in one place to eat his dinner?
We have to remember that muscle isn't just for running. It's functionally what holds the joints and the spine together. Okay, let me make sure I'm visualizing this correctly. If the dog's bones and joints are like the bricks in a wall, is the muscle essentially the mortar holding it all together? So if the scale stays the same, but the mortar is turning into fat, isn't the whole structure at risk of collapsing?
That's a brilliant way to look at it, yes. When that mortar deteriorates, the bricks start grinding together. The structural integrity fails.
Yikes.
The joints take on mechanical stress they were never designed to handle alone, which causes inflammation and eventually a lot of pain.
But if they're losing that muscle mortar, we obviously aren't going to start strapping weighted vests onto a senior Great Dane and making them run hills to bulk up.
No, please do not do that.
Right. So how do you maintain that mortar without breaking down an already fragile body?
It requires a delicate balance of three things: high-quality protein nutrition, appropriate movement, and strict pain control.
Okay, so it's a multi-pronged approach.
Exactly. If the dog is in unmanaged pain, they won't move. If they don't move, they lose muscle. And if they lose muscle, their joints lose that mortar-like support, which directly causes more pain.
Yeah.
It's this vicious cycle that you and your vet have to interrupt.
Well, if that mortar is failing and the structure is getting wobbly, that brings us right to how they actually move. And here's where it gets incredibly complicated, I think, because we have to talk about the stoicism of the Great Dane.
This is such an important point. A Great Dane will often keep following the family from room to room, leaning on you, wanting to be involved in everything, even when they are in significant physical distress.
Which is just heartbreaking.
Their pack drive and loyalty can completely mask serious pain.
It's a tough pill to swallow. Like, a dog's willingness to participate in family life is not proof that pain is absent.
It's really not. They won't usually cry or yelp from chronic arthritis. The signs are much more subtle.
Like what? What should we look for?
You'll see stiffness when they get up after a long nap. You might notice them panting heavily while they're just lying on the floor. Maybe it's a weird hesitation before a set of stairs they've walked up 1,000 times, or a noticeably shorter stride on walks.
Or maybe they get grumpy.
Yes, suddenly flinching or grumbling when you pet them in a spot they used to love. That's a huge sign.
We also have to factor in breed-specific neurologic issues, right? The sources mentioned wobblers syndrome as a major factor for giant breeds.
Wobbles is a classic example. It happens when the spinal cord in the dog's neck gets compressed.
Okay.
Because the neurologic signals from the brain literally can't make it down the spine to the back legs properly, the dog loses proprioception. They essentially don't know where their back feet are in space.
Wow, so it's a communication breakdown between the brain and the feet. That explains the symptoms the sources highlighted, like the back feet crossing over each other when they walk, or paw dragging.
Exactly. If you hear their nails repeatedly scraping the floor, especially on concrete where it's audible, that is a massive red flag. Take a look at the middle nails on their back paws. If they are worn down flat compared to the outside nails, they are definitely dragging.
That's a really practical tip.
Yeah, and you should note which paw it is and whether it gets worse after a walk. And please don't force them to walk more to test it. Just grab a quick video of their normal movement to show your vet.
Okay, so imagine your dog is following you from room to room. If they are so desperate to be with you that they'll actively hide a compressed spine or severe arthritis, how are we supposed to distinguish between a dog who is genuinely just slowing down naturally versus a dog who is actively hurting but putting on a brave face for you?
It goes back to observing those deviations from the baseline we talked about. Natural aging usually just looks like decreased stamina. They get tired faster, they sleep a little deeper, but pacing the house at night, excessive panting at rest, avoiding physical touch, or changing how they sit or posture themselves, those are active indicators of pain. And a critical rule here, if you suspect your dog is in pain, never, ever reach for human pain medication like ibuprofen or acetaminophen.
Yeah, they process medications completely differently than we do. It can be toxic.
Highly toxic. It can be fatal. Pain management has to be evaluated by a vet because a senior dog can easily have orthopedic, neurologic, and metabolic conditions all happening simultaneously. You need a highly targeted approach.
That makes sense. And if they're stoic enough to mask a failing hip or a compressed spine, it makes me wonder what else they're masking internally. Which brings us to the silent threats. So we're not just dealing with bones and joints here.
Not at all. We have to look under the hood at the internal organs. Let's start with cardiac health, which is a major known vulnerability for Great Danes.
Right, their hearts work so hard.
They do. If your dog is suddenly falling behind on walks, showing unexplained weakness, or breathing with their mouth open while just resting in the living room, do not assume it's just old age or fatigue. A quieter senior dog might be quiet because their heart is failing.
I want to zero in on that open mouth breathing at rest. Is panting while resting kind of like a car engine running hot while it's idling in the driveway? Like, if it's working that hard while doing nothing, that's our red flag, right?
That's exactly the mechanism. If the heart muscle is failing to pump blood efficiently, the body is basically starved for oxygen. So the dog compensates by panting heavily to draw more air in, even though they aren't exerting any physical energy.
Wow.
If the engine is overheating in park, something is fundamentally wrong. Your vet might ask you to track their resting respiratory rate, which is how many breaths they take per minute, while deeply asleep to monitor for fluid building up in the lungs.
What about sudden collapses? The sources mentioned this as a potential cardiac symptom.
A collapse could be cardiac, it could be neurologic, or a metabolic crash. If it happens and it's safe for you to do so, note what the dog was doing right before. Check the color of their gums, which should be a healthy pink in time how long the episode lasts.
But the sources were incredibly clear on one point here. Do not delay getting to an emergency clinic just to perfectly document a collapse episode. You don't wait around trying to get a perfect video if your dog's gums are turning blue.
Oh, absolutely not. Severe breathing difficulty or pale blue or gray gums or drop everything, immediate emergencies. Get to the vet.
Okay, we also need to tackle the C word, cancer.
Right, for Great Danes, osteosarcoma, which is bone cancer, is a statistically high risk. This disease destroys the bone from the inside out, severely weakening the structure.
Which is terrifying.
It is. This is why a persistent limp in a senior Dane should never just be quietly normalized for months on end. If there is sudden severe lameness or intense pain after something minor, like just stepping off a curb, it could actually be a pathologic fracture because the bone has been hollowed out by a tumor.
Which means checking for unusual lumps and bumps at home is still crucial, even if they already have arthritis and you think you know why they're limping.
Yes. Check them regularly. Track the location, size, and shape of any lumps. Take photos with a coin next to them for scale. But please, don't squeeze or poke them aggressively, and don't try to diagnose whether a lump is benign or malignant just by how it feels under the skin.
Right. Leave that to the professionals.
Exactly. Let the vet do a needle aspirate to know for sure.
And speaking of internal emergencies, there's one that hangs over the head of every giant breed owner from day one. GDV, commonly known as bloat, where the stomach fills with gas and twists on itself.
I cannot emphasize this enough because it's a dangerous misconception. The risk of bloat does not go away with age.
Wait, really? People think it does.
Yes, but in fact, as the ligaments holding the stomach in place naturally loosen over time, the risk might actually increase in seniors.
That's terrifying.
If your senior Dane is repeatedly retching without producing vomit, pacing frantically, drooling excessively, or showing severe restlessness, it is the exact same life-threatening emergency as it would be for a 2-year-old dog. Blood supply to the stomach is being cut off, and you literally have minutes to act, not hours.
Okay, so we have all these structural vulnerabilities, the hidden joint pains, the silent cardiac threats, cancer, and bloat. It honestly sounds overwhelming. The natural human instinct here is to want to wrap the dog in bubble wrap and never let them move again, just to keep them safe. But how do we modify the environment to protect them without ruining their quality of life?
Well, the first modification is actually an attitude adjustment regarding exercise. I advocate strongly against stopping exercise.
Even with failing joints and a potential heart condition, that seems counterintuitive.
I know, but movement is life. It stimulates digestion, it regulates their sleep cycle, it maintains that crucial muscle motor we talked about earlier, and it provides vital mental enrichment. The key isn't stopping, it's adapting. The goal is what he can safely do today, not what he did at age 3.
So we're talking much shorter, flatter routes.
Slower pace, way more time allowed just for sniffing rather than marching for distance.
Yeah.
And the true metric of whether a walk was appropriate isn't how happy he looks during the walk, it's analyzing how he recovers the very next morning.
Ah, the morning after test.
Yes. If he is incredibly stiff or reluctant to get out of bed the next day, you overdid it and you need to scale back the distance next time.
That makes total sense. Now, what about inside the house? Because the physics of a 140-pound dog navigating a home change entirely when they lose muscle.
Traction is everything. Slippery hardwood or tile floors absolutely destroy a senior dog's confidence. Every time they microslip, it sends a jolt of pain through weakened joints.
And they remember that pain.
Exactly. If they slip and fall, they become psychologically afraid to walk on that surface.
Yeah.
If they're afraid, they stop moving, which accelerates the muscle loss. It's a rapid, devastating spiral.
So we have to ditch the loose throw rugs that slide around.
Ditch anything that slides. Install stable, non-slip pathways, like yoga mats or specialized carpet runners, leading to their food, their water, their bed, and wherever the family hangs out.
What about getting in and out of the car?
We have to rethink how they travel entirely. Jumping down from an SUV is terrible for their front shoulders. You need to incorporate ramps, secure safety harnesses, and plan for frequent travel breaks.
And their beds, too. The sources noted that senior beds need to be supportive enough to prevent pressure sores on their elbows and hips, but large enough that the dog can stretch out completely without falling off.
Yes, orthopedic beds are a must.
But I have a question about all these environmental changes. Listening to this, non-slip paths, blocking off stairs, building ramps, it sounds almost like toddler-proofing a house, but in reverse.
How do you mean?
Well, instead of restricting access to keep them safe, we are adding traction and ramps to maintain their access to us. But how do we know when a ramp is actually helping versus when it's just masking a medical issue we need to treat?
That is a fantastic point. And the answer is that environmental modification and medical treatment are a partnership. It's not an either situation.
Okay.
Good traction and ramps prevent acute injuries and help their confidence, but they don't replace an actual veterinary evaluation of real weakness or pain. The ramp assists the dog mechanically, while the vet treats the inflammation medically. You really must do both simultaneously.
Modifying the physical environment to assist them makes sense, but that strategy hits a wall when the dog's internal perception of that environment starts to fail.
Yes, we have to account for sensory shifts.
Yeah.
Vision and hearing loss are very, very common. If your Great Dane is suddenly hesitating in dim light, bumping into door frames, startling easily when you touch them from behind, or seems to be completely ignoring your commands, that isn't them being stubborn.
They aren't ignoring you to be difficult. They literally might not hear you or see you.
Right. Never punish a senior dog for reduced responsiveness. You have to adapt your communication.
How do we do that?
Start using exaggerated hand signals. Approach them from the front where they have peripheral vision, or use heavy footsteps to create floor vibrations to get their attention before you touch them.
And then there is the mind itself, the cognitive changes.
Cognitive dysfunction syndrome, which is essentially canine dementia. The classic signs can include pacing the house in the middle of the night, altered sleep-wake cycles, getting stuck behind furniture and not knowing how to back out, staring blankly at walls, or suddenly house soiling when they've been perfectly reliable for nearly a decade.
But the sources issued a massive warning here against couch diagnosing.
Yes, absolutely.
If a dog stares at a wall or paces at 2 in the morning, our human minds immediately jump to dementia. We project our own aging fears onto them. But couldn't pacing all night just mean they have a horrible stomachache? Or they desperately need to pee but it hurts to walk to the door?
It absolutely could, which is why couch diagnosing is so dangerous. We see them pacing and assume their mind is gone. But pacing, anxiety, or accidents in the house could easily be unmanaged pain, urinary tract disease, a side effect of a new medication, or even just vision loss, making them disoriented in the dark.
So how does a vet actually differentiate between a dog pacing from arthritis pain versus a dog pacing from cognitive decline?
It's a careful process of elimination. A vet will typically run a urinalysis to rule out an infection causing the accidents. More importantly, they might prescribe a short trial of targeted pain medication.
I see.
Yeah, if a dog starts sleeping peacefully through the night again on the medication, you know the pacing was caused by physical pain, not dementia. You cannot apply a cognitive label until you have definitively ruled out physical suffering.
Speaking of physical suffering they tend to hide, we have to touch on dental health. A senior dog will happily crunch through their kibble despite horrific oral pain.
They are incredibly tough that way.
Yeah, and age alone isn't an excuse to skip a dental assessment, because the bacteria from rotting teeth enters the bloodstream and compounds the heart issues we talked about earlier.
Exactly, which is another reason why we have to actively adjust family dynamics as the dog ages. Their overall tolerance for chaos just drops.
Kids cannot climb on or roughhouse with a senior dog anymore. They need to be taught to respect the dog's space, especially around areas like the lower back or hips that might be secretly tender.
And if you have a multi-pet household, an older dog shouldn't be forced to entertain or correct a pushy, high-energy puppy all day. They need a designated, protected space where they can rest without being bothered.
And their daily routine might need to shift too, right?
Yes, and this catches many owners off guard. Their ability to hold their bladder or cope with being left alone during a long workday may dramatically shorten. They might need a dog walker midday or more frequent medication schedules. It isn't spite or manipulation. It's a genuine shift in their physiological capability.
So we've navigated the physics of muscle loss, the deception of their stoicism, the silent internal threats of heart disease and cancer, adapting the home environment, and handling sensory and cognitive decline. To synthesize this whole journey, caring for a senior Great Dane isn't a tragic, depressing countdown. It is a phase of profound, active adaptation.
It really is.
Yeah.
It's about diligent observation, tracking the trends of their behavior, working closely with your vet to manage the mechanics of their body, and modifying your home so the dog can remain safely anchored at the center of your family's life.
And a quick tip for you listening, to help track those subtle trends and organize all the different medications, you can use digital tools like the Vital Pet app to keep all those records in one accessible place for your vet. But as we wrap up, we have to address the emotional core of senior care, quality of life, and eventually end-of-life planning.
Determining a good quality of life for a senior Dane requires us to recalibrate our own expectations. A good life doesn't require youthful, high-energy activities. A short, 5-minute sniffing walk, eating their meals comfortably, and resting in a sunny spot on the floor near the people they love, that is often entirely enough for them to be completely happy.
The goal isn't preserving their old routine in amber. It's protecting what they genuinely value right now.
Exactly. And part of protecting them is having the courage to discuss euthanasia and end-of-life planning with your vet before a crisis hits. You need to understand the trajectory of their specific diagnosis, discuss pain control honestly, and figure out what your emergency options are, like at-home euthanasia versus the clinic, while you are calm and can still think clearly.
It's the ultimate act of love, making sure their exit from this world is as graceful as their life was. Which leaves me with a final thought to ponder today. We spend so much energy and anxiety worrying about our dogs getting older. We dread it.
We really do.
But watching a dog gracefully accept their aging body and find profound, complete joy in nothing more than a sunny spot on the carpet and a shorter walk, it makes you wonder. Could observing their graceful decline actually teach us something fundamental about how we humans constantly resist our own aging? Maybe they aren't just relying on us to provide senior care. Maybe they're actually showing us how to age.
Wow. That is a deeply profound perspective to take away from this journey. I love that.
We want to remind everyone that this deep dive is for educational purposes only. Always consult your veterinarian regarding your dog's specific health and medical needs. And if you're wondering how all of this fits into the broader picture, like how families actually manage the space, the costs, the visitors, and the sheer scale of a Great Dane across their entire lifespan, join us for our next deep dive based on episode 9, where we will cover the realities of living with a Great Dane day to day. Until then, keep an eye on that sunny spot.